the nurse has to call in that referral to the organ sharing network. And so that filters to us, and it filters to LifeShare, who is the organ and tissue bank. They do the same thing we do, but just with skin and bones and then with whole organs. So we get a text message that tells us check our email. We check our email. It tells us the referral, the name of the person who died, bits about their medical history, and then we acknowledge that. And if it's for us only, we will call the nurse back and get information. If it's a case shared with LifeShare, because they take just about everything we do except cancer, they screen for us. So they will call the nurse back. They will get the information. And if it's suitable, at that point we'll call the family and see if they're willing to donate. If they are, we do a medical questionnaire, which is similar to when you donate blood. Probably most of you have done that. And so as long as that checks out, then we'll coordinate with the funeral home or the medical examiner's office or the hospital to go to their location and recover the corneas. So once we've done that and we have the corneas back, we draw 2 tubes of blood from the person when we're at the location, bring that back, and we ship that to Colorado to be tested for hepatitis, B and C, HIV, and syphilis. And so while we're waiting on serology results, we go ahead and request medical records. And sometimes, I left this morning, we had 1,300 pages to read from one chart. So it just depends on how long they've been in the hospital. Sometimes they're ER deaths and there's 25 pages. So we have to read that chart and make sure there is nothing in there that could ever harm a recipient. And so any kind of an infection like sepsis, bacteremia, anything like that, certain kind of cancers we can't take, blood cancers, that type of thing. If they have an eye disease or an eye infection, we can't take that, obviously. And so we go through these records, and if that's deemed suitable, then we move on, and I look at them under 2 different microscopes. There's a slit lamp, which is what your eye doctor looks at when you put your head into that machine and he does a light. That's the slit lamp. So we have a holder that will hold the cornea in there. So I look at that, and I look at all 5 layers of the cornea and make sure there's nothing wrong with any of them. And then we put it to the specular microscope, and we take pictures of the cells, and then we count the cells to try to see what the cell count would be. The higher the cell count, the more likely that the transplant will be good. So what we can transplant above 2,000, but we really consider a good cornea about 2,600 and up. And the younger the patient, typically, the better the cornea is. So if you have a child, say an 8-year-old, they might have a 3,500 cell count, whereas a 70-year-old may have a 2,400. But that doesn't mean 100% that the surgery would be better in either case. A lot of it depends on the recipient, a lot of it depends on the surgeon. So if everything on that checks out and the cells look good, then we will contact one of our surgeons. We have a surgery schedule that says when they have surgeries and offer them the tissue. And if they accept it, then we'll ship it via FedEx or drive it, to the hospital, wherever's closer, and then they have the transplant. And they go back for a follow-up the next day, and I believe they go back a week later. And they take steroid drops and antibiotic drops for a little while, but this transplant is about 96% successful, and so there's very little rejection, very little infection that goes on, and it's not blood type match like an organ. So like a heart, you have to go through a ton of tests to find a recipient to match up with, and a cornea doesn't. So you can have my cornea, I can have yours, it doesn't matter. We just try to keep them kind of close in age. So if we have a 30-year-old needing a transplant, we'll try to find someone between maybe 20 and 40 so that cornea will last longer. Because if we put a 70-year-old into a 30-year-old, then they're probably going to have a repeat transplant down the road. So yes.
I'm curious, how do you count 2,000